Fractures is a break in bone. Break in bone. Cassette. Injuries you don't break. Who cannot hear me? Everybody can hear me, true? So we shouldn't have no reason pushing. That's why I put the speaker loud, so everybody can hear me. True? Okay, so fractures is a break in bone. So cassette. NCLEX asks you, what are type of fractures? Ready? Close. Complete. That's what I want you to know. I'm not going to give you all the lists. Just read the ones I give you. I'm on page 858, box 58-3. Everybody with me? Now, close, highlight that. Complete, highlight that. No, mommy, page 858, baby. You wrong page. You need a green box right there. Complete, green stick, NCLEX question. What is green stick, Miss Sonia? Green stick is the true fracture, the God fracture. Anytime you fall, right? You fall by putting your hand down. So when the bone break, it break this way. That's the good fracture. If I abuse you, look, if I abuse a child, I abuse the child, the bone gonna break like this. That is called spiral. Spiral is abuse. That's an NCLEX question. Spiral is abuse. Green stick is normal in kids. Green stick is normal in kids. So you need to know complete, green stick, incomplete, spiral, and sometimes you want the oblique line. Just know the definition. So let me give them again. Complete. Green stick, I want you to put good next to it. Good fracture in kids. Oblique, the break extends in an oblique. Know that for NCLEX. Spiral, abuse. Put abuse. Bad next to it. Any question? We cool? Cool. Okay. Now, we fix fractures. Fractures, zo cassé. That's what fractures, a break in the bone. We fix it 4 ways. 4 ways. 1, 2, 3, 4. This is where your NCLEX question come in. The first way we fix fractures is called reduction. 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 Miss Sonia, what is reduction? She come in the ER and she came in like this. That means one arm short, right? But, oh, I'm in pain. Oh, I'm in pain. Sometimes we will medicate her. Sometimes we will not, right? Sometimes we will medicate her. Sometimes we will not, depending up to the ER doctor. So she came like this. Look, one arm long, one arm short. So while she talking to me, right, the physician come in. If she's in so much pain, we will give her lidocaine or they will put her to sleep. It's up to the physician. And while she's asleep, they will go. Click. She wake up just like this. Reduction means alignment. So we fix fractures 4 ways. The first way is called reduction. Green box, 858, box 58-4. Reduction, alignment. Ready? Reduction, closed reduction, is non-surgical, right? They can give you anesthesia, or they just do it. Sometimes they will do the reduction and put a cast. You got that? 99.9 reduction is non-surgery. Non-surgery. Just click, 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 click. She's back to normal. Any question? So you are responsible to read box 58-4, reduction, and E. Highlight E. 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 Now, the second way we fix a break in bone, fixation. Fixation. Are you guys hot? Fixation. Fixation is surgery. Fixation is surgery. Fixation is surgery. Surgery. So, there's an open fixation and closed, right? And the fixation they use is called ORF. And ORF, you have a picture in your book. Fe. They put stents to keep the bone together. Stent. Fe. They put metal in your bone. The fixation is that picture right here. You see that? Anytime you have a history of fixation, you will never get MRI. Anytime you have history of fixation, you will never get MRI. How do the doctor prevent the patient from getting infection? Ou fail, I'm saying in English, you mette antibiotic sous lui. Parce you couvri, et puis put it in the body. English, they will take the stent and they will coat it with antibiotic and put it to attach the bones together. Very important. ORF is a medical procedure that they do to hold the bones together. Sometimes they leave them in, sometimes they take them out. Because you know, bones kind of grow back. You guys know that. All right? Any question? So we fixed fractures two ways so far. Reduction and fixation, which is what? Surgery. So NCLEX not going to ask you about the fixation. NCLEX going to ask you pre-op, post-op question about the fixation. Yes?
The fixation, the ORF.
The ORF.
The ORF.
ORF.
When they put the antibiotic on it,
Your
it
cool.
last for a long time?
Not last for a long time. Prevent you from getting infection. Parce qu'ils sont en feuillet. It's a metal.
But for a period of time?
Yes. When they put you on it, they also going to send you home with antibiotic. Or if you are history, if your immune system low, put a home health care nurse to give you Vanco. So you at risk for MRSA because of all the antibiotics.
So something like that where the facet is
Yes, you make it fair. They put the fair and they coat it. Okay? And sometimes they don't have to go in. Like if your friend is healthy, they don't go in and put more antibiotic. Yes, Robin.
You know how you said that if a dog bite or you get stuck in the body, or needle stuck in the body.
You get tetanus shot.
Did you get that?
No. You don't. Listen to what she said. When you get an ORF, do you get tetanus shot? Tetanus shot is given to prevent you from getting toxin from whatever stick you, nail, piece of glass, glue, something get in your hand. That's why you get the tetanus shot. Not this, darling. Any question? We understand what she asked. When a dog bites you, you get tetanus shot. Why? Rabies, right? Rabies and what else? Infection. Here, guys, it doesn't necessarily mean cow will have infection. I put it as a preventive measure. We got it? Yes. ORIF. It's a surgery. It's right here. Here's the picture. Mindy. On fait une kebezoa. A bone. They hold it. Any question? We cool? Okay. Then here is where NCLEX asks you all of your questions. 2 places. Something called traction and cascade. So I'm going to spend 99.9 of the lecture right here. Now, where the students go wrong, the book don't have lecture on traction, but the book have pictures, and the students don't study the pictures. So anytime you have a fracture, I told you we fix it 4 ways. The traction is a form of alignment. After the traction, we can put a cast. Do you understand? Now, anytime we do traction, that means the break was a little on the bad side, because if it wasn't so bad, we would only do what? Reduction. Because we got here, that means the bone is kind of bad. You got it?
Okay.
So, traction. Here it is. School taught you Russell. They taught you Bucks. Podiap student never know what those mean. So today I'm going to explain to you what those traction mean. Look on page 859. You're going to put a little note. I cannot go to NCLEX without knowing those traction. Please, and those who went and took a test, you know they killed you on the traction. True? Now, there's different traction for different area of break. Coward, who had a big accident on 95. Coward broke her hip. Coward broke her leg. Coward broke her head. So there's different traction for different part of the body. Ready? Let's go. Look, the first thing I need you to do, you're going to see a little thing that says figure 5.8.2 or 5.8-2. You see it? Yeah. I want you to, don't highlight it. I make a circle around it. And I want you to put, this is my license. Here. And I'm going to show you why. Just don't highlight it, because then it's hard for you to read. Just highlight like a circle and put license. Okay, I'm going to show you why. Students never read it. Raise your hand if you don't follow me. I will help you. Raise your hand if you don't see it. Everybody see it? Okay, now, look at A. A say Bucks traction, right? So Bucks, remember the school taught you that. Now, but the school never told you what is Bucks traction. A picture is a Bucks traction. A picture is a Bucks traction. A. Where A? Now, NCLEX asks you several questions about this traction. They ask you, what part of the body get a Bucks traction? The student don't know. What part of the body is that? Leg, but what part of the leg? Femur? Half. Right? Now, look under the feet. What do you see? Under the feet, en bas pied. No, babe, a board. The reason there's a board so the patient don't have foot drop. A board. Now, suppose you do not have a board. What do you put there? Tennis botio. America, we say Converses. Haitian people say tennis botio. Tennis qui rive là yo. The Converses. That's an NCLEX question. Buck traction, there must be a footboard. If no footboard, you will use high top sneakers. Right? Which part of the leg? Calf. Now, let's look at the bed. Let's look at the bed. Let me ask you a question. Do you see a pillow under the leg? No. Okay. What happened if a CNA put a pillow under the leg? The degree will change. The degree is the medication. So NCLEX asks you, when would you intervene when you see the CNA put a pillow under the leg? The bed is flat, no pillow. Now, what's the purpose of this? The purpose of this is to keep the bone straight. So yes, the patient going to be in this position for 24 hours, which is a part. When you keep me in a situation where I cannot go to the bathroom, isn't that a form of restraint? So NCLEX asks you which patient you're going to see first, that patient. Why? Because that patient cannot go to the bathroom, cannot do nothing by himself. And suppose the patient say, Nurse Sonia, this too tight. You cannot remove the what? Weights. The weights cannot touch the floor. So weight cannot touch the floor. Then NCLEX asks you, how much weight? 8 to 10 pounds. 8 to 10 pounds. The weight cannot touch the floor. If the patient says it's too tight, you need to call who? The doctor. Now, here's the NCLEX question. Suppose the bed is broken. Who do you call? The maintenance. You don't call doctor. Doctor gonna cuss you out. Doctor don't deal with bed. The doctor don't deal with the bed. They got maintenance. Something else you're going to see in the bed. Trapeze. Because the patient cannot slide down. So, they will. But they're going to use the what? Trapeze. Any question? Now, let's go to fundamental. What type of food he will eat? High protein, high vitamin C. Let's stay in fundamental. Would you see this patient get TPN? No. Why? That's not enough what? Nutrients for him to heal. Would you give him bedpan? Yes. Would you come talk to him? Yes. Will he be the first person you see? Yes. Why? Because he's isolated. What I mean isolated, he cannot do nothing himself. So of course, you're going to come talk to him. Any question with buck traction? So you go to NCLEX and they ask you buck traction. Bring me with you. Med surge, multi-skeletal, fractures. I heard somebody say position. Fractures. Right? Yes. So we fix fractures 4 ways. Reduction, fixation, traction, so far. Any question? And you know buck traction. Who did not understand? Okay? We cool? All right. Now, second type of traction is called Russell. Russell, look at what part of the leg. Be careful. What part of the leg? Thigh. Be careful. What do you see under his leg? Footboard. Do you see a pillow? No. So they go to question. Which one would you intervene? Hi. When you see a nurse putting a pillow under the leg. Because guys, if you put a pillow, that will cause the degree to change. You cannot put pillow. Right? Russell, so make sure you know that. The patient have a traction. Be careful. What's priority? Fluid, skin. Fluid, skin. Pain medication, and enema. What's priority? Fluid. Why you didn't take skin? Somebody took skin. Because if you give fluid, fluid fix the skin. Stay away from the norm. Who did not get that? And they're going to have skin right there waiting for you, Susan. Stay away from the norm. Okay? Remember, if I ask a question and half of the class say the obvious, that's not the answer. Can you promise me you're going to remember that? So if I say, you are given a atenolol, right? What is your initial nursing intervention? And before, what would you do first? And you say blood pressure, take the blood pressure. That's wrong. NCLEX, no, you know that. Atenolol is a what? Beta blocker for blood pressure. Atenolol make what goes down? Heart rate. They know you know that too. Respiration. Heart rate and BP is the norm. Are you kidding? They know you know anytime you give blood pressure medication, take the blood pressure, take the pulse. That was the answer when I took my test, not yours. They want to know. You know when you give beta blocker, it causes bronchospasm. Come on, people. Stay away from the obvious. You got me? I think you just feel me. Stay away from the obvious. Remember what she said yesterday? The obvious would be there. That when I asked, what's priority for traction? Check skin. 99.9 student will go there. They got it there for you, waiting for you. That's not the answer, people. 10 years ago, it was the answer. Not today. They want you to critical think. Okay? Any question? Then we go to C. Boy, this is called a cervical, right? Or head halter. This is put in normally when a patient got car accident. Let's look at the head first. Don't look at the bed. Let's look at the head. What do you see under the head? That's the bed, by the way. That board is that bed, or whatever they put them on. What do you see under the chin? A padding. Why? Skin breakdown. What do you see in the back of the head? A padding. Where else should we have put a padding to prevent skin breakdown? Behind the ears. Okay, so they ask you question on the padding. Now, suppose they don't have a padding. What am I going to do to prevent breakdown on a patient? Talk to me. What am I going to use to prevent skin breakdown on a patient? No, they don't put padding there. Powder. Come on. Oh. Put back of the neck. Here to prevent what? Skin breakdown. Oh, how many see CNAs we had. They taught that in that CNA school, though, for real. Yeah. Okay? Powder. Food. Guys, we put food to keep dry between your toes. We don't put lotion. We put what? Powder. Jock itch. You know what? You ever bought a Lotrimin spray? And you men put it there private and women put it under their breasts. When you spray it, what is that? Powder. It's spray powder. Powder help take in what? Moisture. Hold on. I'm going to tap one at a time. Yes?
There's a new thing that said actually use powder to
I could have told you that. When you use, because you know Haitian people love powder. When you take powder and put in your underwear, it causes ovarian cancer. And when you use powder a lot, it causes respiratory problems. I read that on TV. But darling, if you take powder and put between your toes, that prevents moisture for sticking in. That's all I'm saying. If you put powder here and here, that prevents skin breakdown. I said lost weight. Comprends samedi? That's where you sweat. Yes, question. Somebody said.
That's what I was going to say about the respiration problem.
That I could have told you that, yes. Not only respiration problem, special amens one. Haitian people, amens, you put it all over the top. Guys, amens burn you. It's medicated powder. So when you put it, and the child, oh my God, it's so hot. For Haitian people, the child not clean if you won't have powder all over with that little Haitian dress. Okay, any question? We cool over here. All right? So remember those. When you have traction question, NCLEX asks you on the body, the patient, and they ask you on the bed. So you gotta keep your eyes open. Now the bed have a string. The string is used to hold the weights together. When the string break, right, they call that fraying, déplimé. You know how you have a Metro PCS charger, and when the charger gets old, it start what? Coming apart, and you see the little blue thing inside, and you see the red one. That means that is called fraying. So you gotta watch that there's no fraying. Fraying is déplimé because if it fray, it can what? Break. Any question? Okay? We cool? Head halter. Do you see a pillow under the head? No. The weight. Not the weight never touch the floor. The weight, nobody sit on the bed. Which one would you intervene? When the family, the patient got a visitor, and the visitor sit on the bed. The visitor cannot sit on the bed parce que si chita sou cabane nan, weight la pe fe ki sa, manye a terre. English. If the visitor sit on the bed, what happened to the weight? Go down. Now, suppose the patient say, Sonia, oh my God, this is too tight. Take weight off. Can you do that? No. You cannot remove the weights. You gotta call doctor because the medication is the what? The weight. Okay? Now, then we go into D. Who little leg is that? A child? Come on. Pelvic. Who breaks their pelvic? An old lady. Look at her old leg. She's old. Now, do you see a pillow? Yes. Ah, where's the pillow? Ah, abduction pillow. Right? Abduction, not addition. right? Adduction is addition. Ab, I abduct the child. I took the child away. So you need ABD. ABD, got it. ABD, ça relate abduction. Abduction means away. Ou besoin, ab, away. Addition, add is together. You don't want this. Ou pas vle ça. This a no. Adduction. Ou besoin, abduction. When you get an amputation, you need an abduction pillow. C'est pas addition. Ab means away. We cool? Who do not understand? Where's your tape? You have your tape? Abduction means away. Addition means together. Ab, gardez oui? A-B-D. Meaning away. So, regardez. You put the pillow in the middle et puis bout de jambe yo tombe comme ça, regardez. You got it? Okay. Now, then we go into the guy, the bottom. The guy in the bottom. This guy have multiple breaks. He broke everything. That's a big NCLEX question. I want y'all to take that same highlighter and I want you to highlight the guy with all those breakage. You see that? Figure 58.3. The one with the laying on the bed. You see that? Okay. You see, that is called J. Now pay J in the back of your book. I mean, not in 860, pardon. That's J. That is called a balance, suspension, traction. Everybody with me? Okay, and I want you to put NCLEX next to the J. Mete NCLEX. Balance, suspension, traction. Miss Sonia, what does that mean? This patient went on I-95, had a big accident, got multiple breaks. Now, balance, suspension, they will put him in this traction, but the traction they put him in will have pins. He will be connected by fat, metal, pins. Now, once you have a balanced suspension, traction, priority is infection. We need to clean the pin site daily. With what? Hydrogen peroxide. So look, we're going to go from E on up, intervention. J, I'm going to take it E and I'm going to go up. Ready? E. Clean the pin site with sterile normal saline or hydrogen peroxide. If NCLEX put Benadine, get it. Because if they don't put those and they put Benadine, you can use Benadine too. But that got to be ordered. Okay? Now I'm on D. Provide pin care. C. Protect the skin from breakdown. Stop. Pin care, skin breakdown. Stay with me. Anytime NCLEX asks you, what's priority with balance, suspend, traction? Priority is infection. So the answer is pin care. Any other traction, priority is skin, fluid, yomandosa. Again, anytime it says balance, suspension, traction, they looking for a certain type. Priority is infection, pin care. Any other traction, priority is skin and it's fluid. You got it? Just like if I say the patient is on blood pressure med. I didn't say no which type. I just said blood pressure. So for example, I'm going to give you 2 questions and I'm going to change it. Watch this. The patient is on blood pressure med. What's priority? The answer is either BP or heart rate. The patient is on buck traction. What's priority? Skin, fluid. The patient is on atenolol, which is what? A specific blood pressure med. What's priority? Not BP? Bingo. The patient is on suspension, balance, traction. What's priority? Infection. This is why infection. This is what you must do to pass NCLEX. If they want broad, that's the norm. If they want specific, that means they're looking for something from you. You got it? Who did not get that? You got it? Please understand. And that's why when the students read, they get so mad. They say, well, I read. Yes, you read, but you didn't understand what the people was trying to ask you. That's where the critical thinking come in. So you're going to say, well, Miss Sonia, traction, but traction, skin. I got you. But when they ask you specific traction, there's specific things go with specific traction. Yes, skin care is good for balance suspension. I know that, you know that, they know you know that. But they say balance, suspension, they put pins in the, you hold the patient bone with pins. So priority for that particular one is what? Okay. Any question? Who did not understand? We cool? Now, anytime you, any traction you want, healing, high protein, high vitamin C. Any traction, the patient is secluded. So you know the patient may commit suicide. Because why? You don't come see me, you don't come talk to me, I'm isolated. Okay? Let me ask you a question. What safety has to do with attraction? Nothing. I'm in place, I'm not moving. So why would you put safety? The crime doesn't meet the punishment. Why would you put pain? Which traction you may see pain? Critical thinking. Which traction you may see pain? The one with the pin. The one with the suspension. Because it's multiple what? Fractures. Est-ce qui nous comprend? I'm on traction. Should you monitor my output? Remember, I'm not moving. When I'm not moving, what happened to calcium? It shifts. It leaves the bone and goes to the blood. So anytime I put like that, you must check how often I'm saying, hey, can you bring the bedpan? You gotta give them a bedpan. They don't go to the bathroom. They poop there. They pee there. So isn't it nice that you come take the bedpan, wash it? Don't cover it on the bed. Wash it, stick it under the bed in a bag. You see that? In a bag. Remember, he's going to be there 24 hours. Imagine you take a bedpan, you cover it under the sheet. I eat there, I poop there, you see that? So they can ask you all these questions about food, right? Positioning, patient commits suicide, depression. Remember, I'm not doing nothing, nobody talking to me. Hell, people passing by, I can't move. I'm depressed. They can ask you those questions. They can ask you food. They can ask you skin breakdown. They can ask you about the kidney. They can ask you about putting pillow. They can ask you about the weight touching the floor. You got it? They can ask you about the trapeze. Any question? Yes?
With positioning, I know we cannot leave the weight. So how would you administer that?
Oh, they got a what?
Yeah.
They use the trapeze. Now, what kind of bedpan would you give them? A fracture bedpan. Ou pa ka ba yo gros bedpan, gros baga ti flat black. The little black. You see where all the questions come in? So the people can ask you how to give the bedpan. See? Either or. So does it matter? Does it matter what question they give you? Does it matter? Box, you safe. Russell, you safe. Head, you safe. Suspension, you're safe. Any question? And you cannot without traction. Mundo Talia, you know what I'm talking about. Who went and you had some traction questions? I know you did, girl. What? Okay? The fourth way we fix fractures, the last way. Cast. There we go with the questions. Now, why we put a cast? Now listen, the doctor can do this first and then put this. He can do this first and then put this. He can do this and then put this. Or he can just put this alone. Any question? Again, the doctor can do this, applique médecin. He can do this and then put a cast. He can do this and then put a cast. Or he can just put up. Any question? Cast. Cast is made with either plaster or fiberglass. Anytime you in multi-skeletal fractures, you will go on an orthopedic floor. Orthopedic floor is the hardest floor to keep to keep nurses. If you go to, you are RN looking for job, go to North Broward website. Sample ninth floor, right? I guarantee you will work there 6 months and you will quit. Orthopedic floor has high turnover, but they pay higher. Out of all the med-surg floor, they will easily pay you $32. How long you will be there? 6 months. Because you will have 9 of these suspension patients. 9 or 8. So you work 6 months, don't come back. High turnover at North Broward. For me as an ER nurse, they'll call me. Can you come work for Sample? Because when you work for North Broward, they can call you all hospital. Coral Springs, Imperial Broward. You want extra, we will pay you double. You know what double? So if you made $50, they willing to pay you $100. Because the floor's short. People say no. People don't even answer their phone. The hospital start calling people on supervisor cell phone. That's how much people don't pick up the phone. Too much work. Because if you don't care for this patient properly, the doctor get mad, cuss, throw things, and you got 8 patients, 8 or 9 patients. You tell me how long you gonna be on this job. No, thank you. Okay? Huh? Right here, plaster and fiber. Okay? Now, once they make the cast for you, you will hold the cast like this. Not like this, guys. Because your nail's gonna go in, right? Sometimes the nurse, especially when you're dealing with kids, they will get the cast and they'll spray paint it. Pink, if she's a girl, boy, they'll use blue, or they'll put a little tape, make it pretty, and put cartoons. You gotta make it kids friendly, children. Now, casts smell very bad when it's time to change. How you know that it's time for the cast to change? NCLEX question. 3 things. 1, it turns yellow. Brown, yellow. Right? So the cast turn yellow or vanilla. 2, as you walking, got the little petals coming off. Right? You walking, you see them. All right? 3, it smell. You can smell it. It's time to take the cast off. Okay? When you take a shower, you do not wet it. You cover it with a big plastic bag. Okay? And they don't want you to take shower, they want you to take sponge bath. Okay? Now, the doctor decides how long they keep the cast in. Now, here is where the questions come in. Normally, when you have a cast, the patient itch. You do not stick a fork inside. You don't stick a pencil. You don't stick a back scratcher. You go get a blow dryer. You put it on cool or cold, and you just kind of use the blow dryer in the cast. You do not stick nothing in the cast. You do not put powder in the cast. You don't put lotion in the cast. You don't put nothing. Any question? Now, anytime you get a cast, let's say I received this cast at 10 o'clock today. So NCLEX put 2-hour post-cast. Anytime you get a cast, the first complication you will get within that 24 hours is called compartment syndrome. Right? Which I'm on page 861B. Compartment syndrome is always the first complication. Miss Sonia, what is compartment syndrome? Once you receive the cast, the doctor put it in. What happened is the doctor left what we call air pockets in the cast. So pressure start building, so therefore you can lose circulation in the finger. Now, anytime you get a cast, yes, you will have some pain. Not pain, but a little discomfort. And I medicate you. 10 minutes later, you call me. I need more medication. Something is wrong. When the patient says that, first thing you're going to do, take vitals. You should see everything high BP, high pulse, everything high. Second thing you'll see, the patient cannot move the finger. Just like that. That is a medical emergency. Now, so look, my finger is like this. I cannot move it. NCLEX asks you, what's priority? Stay with me. You say call the doctor. Look, patient finger like this. I understand you're going to call the doctor, but you need to do something for me right now. Look at my finger. So they ask you, what's priority? Now let me ask you a question. They put, what's priority? Be careful. Call the doctor. Check for pulse by valve. Somebody check for pulse, right? Somebody, let's check. Who would take check for pulse? My finger like that. Look, this is my finger. And you said check for pulse. So I'm going to do what you tell me to do. Check pulse, busy. Check, press my finger. Shh, she checked my pulse. Did that do something for me?
Nothing.
All right, so that's the wrong answer. All right, then I heard somebody say, call the doctor. Go call the doctor. My finger's still like that. Guys, you see, stay away from the norm. My finger's still like that. You need to do something for me now. And you're going to do something called bivalving. You're going to take scissors and you're going to cut off the cast. If you don't have a scissor, you're going to use a pencil, not a pencil, but a pen, to poke holes so that air can come out. Soon as you do that, you're going to see the patient fingers go like this. You relieving the pressure. Look what I got, you guys. I said 2 hours post-cast. The patient, I'm going to add more in the scenario. The patient fingers is blue, whatever. Patient cannot move. You say check for pulse. That don't even sound right. Like, check for pulse. You did. My hand's still like that. Call doctor. You did. My hand's still like that. You did not fix the problem. Now, if I would say, put it in order, patient have compartment syndrome. I didn't ask you which one is best. I just say put in order, right? Put in order. Put it in order. Put it in order. Check the pulse. You gonna check the pulse first? No. Hell, I don't have no pulse. That's why my finger's like that. So what you gonna check? You gonna buy valve first. Then check the pulse. Then call. Oh my God. Y'all getting it. Guys, by my finger like this, that tell you what? I don't have what? So what you gonna check, you already what? No. Listen, do you know check the pulse is the norm? Didn't I tell y'all to stay away from the what?
No.
You know your way to pass, stay away from the norm. You just getting it, huh? Stay away from the norm. You got it, guys? Stay away from the norm. Another norm. The patient is going to have the patient is a diabetic patient. The patient is going to have surgery. The patient insulin was 350. What is your initial nursing intervention? Give it. Give the insulin. Hold the insulin. Call the doctor. Stay away from the norm. Let's go. What would you do? The patient is a diabetic patient. Has a blood glucose of 350. What are you going to do? Give the patient insulin, cancel the surgery, stay away from the norm. Give the patient insulin, cancel the surgery. Let the patient go have their surgery, call the doctor. Give the insulin and cancel the surgery.
No, we can cancel
Give
the
the
surgery.
insulin and
call
cancel
the
surgery.
No, give the insulin.
Why?
Call the
Why
doctor.
not?
It's not
You will
actually
hold the
cancel.
insulin?
No,
Hold on. See?
350.
Hold on. Think. Look. Patient is diagnosed with diabetes mellitus, having surgery, right? Patient blood glucose 400. What is your nursing intervention? Okay, or priority? Watch. A, B, C, D. Check blood glucose.
It's already done.
Call MD. Hold it. Hold it. Hold it. Right? Hold the insulin. Give it. Hold it. Hold the insulin. Give it and cancel surgery. Or hold it, cancel, or let the patient have surgery. Okay, shh. Think. Shh. So, let's go. Hold on. Who wants to talk for row 1? Joanna, you row 1. Who want to talk for row? Not you. I know why. Samantha, you talk for row 2. Row 3. Who want to talk for row 3? You, my darling. PT. You be row 4. Who wants to talk for row 4? Rose, you want to try for row 4? Just try. Just try. Row 1, Joanna, go. Don't, guy, just, if you don't agree, don't say nothing, just let her talk. Please don't interrupt, because I want you guys to hear this. When I say stay away from the norm, this is what's beating the students up. Joanna, the patient is a diabetic patient, is scheduled for surgery, and now the blood glucose 400. Joanna, what would you do as Nurse Joanna? What would you do? Let her talk. Don't let her talk. What would you do? I don't care what you rationalize. Tell me, please. Go ahead. Shh. Come on, Joanna. Come.
I was saying that first to hold it because I know insulin will make the patient beat because he is scheduled to go to surgery.
So you say C. Joanna say C. So tell me, your answer is C so I can write it down. Boy, you didn't see. You say holy. Okay, Joanna say holy. And what's your rationalize?
Because I do not want to give the insulin because it's going to put the patient more at risk to bleed throughout the surgery.
Okay, because of bleeding. All right. Hey, he did Joanna. He did Joanna. Please. Okay, Joanna. Thank you. You gave me. Row number 2, Samantha. Yes.
Okay, I would say hold it and let the patient have the surgery because, once you're diabetic, you're under anxiety when you're going into surgery.
So so you'll say C,
Yeah.
but you say C, but different reason.
Yeah, because-
She's saying C, but so you wouldn't say you saying C, but bleeding, Joanna. You saying C
Because of nervousness, anxiety,
because that's expected. You're stressed. Okay. So 2 say C and high sugar is expected. Okay, now. So now 3. Keep 3. My baby girl. Keep 3, baby. Mommy. 3. Alena.
Okay. Well, yeah, I would hold the insulin.
Hold it.
Again, but you have to fix the blood sugar because if you don't fix the blood sugar, then they're gonna go to hyperglycemic.
Okay, so your reason is you gonna hold it, but you gonna fix it.
Right.
Let the girl talk. Ma'am, say what you saying.
Okay, what I'm saying is that, okay, yes, because they can have surgery, you can't give them insulin because that's where some bleeding. Yeah, I understand that, but then again, if you hold it, I would say give it and cancel the surgery because you have to fix the blood sugar and then call the doctor.
To cancel. So in other words, you will give it and cancel the surgery.
But I will call the doctor.
I know, the doctor gonna cancel. That's what I mean, baby girl. So you go, my girl say, D, Girl, that's what I'm talking about. D. She said, give it. Spela, and the doctor will cancel. All right. Rose, talk to me.
I will choose D because the blood is very high.
Because it's high. Okay, you choose D. Okay, can I give the answer?
Yeah.
Okay. Anytime you're diabetic, it is understood under stress your sugar will be high. So it's understood that that patient blood glucose is 400. I will do nothing and let the patient go to surgery. If the patient had two problems, high blood sugar plus ketone in the urine, now you will hold it. Because now that is called diabetic ketoacidosis.
So you have to check the lab values then.
Ma'am, the answer is C, and you let the patient go to surgery. Because for you, now she said bleeding. I got that. But PO med causes more bleeding than insulin. Now, let me tell you why you would not give the patient the insulin. Miss Sonia taught you that in pre-op, post-op. Insulin has two jobs. It removes the sugar, but while it removes the sugar, it will remove the potassium. Will put a patient that's on surgery in heart problem. Any questions? So yes, I got all your answer. C is right, but the explanation is wrong. So that tells me you really don't understand. But the answer is right, but the explanation is wrong. For me to hold it and call the doctor to cancel it, two things gotta happen. Your sugar is high, plus when we check the urine, we see ketone. Hey, that is called what? Diabetic ketoacidosis. That patient must go to ICU.
Can you give us a scenario where you would choose the, D?
Would you choose D, which is give it and cancel? I just told you. If the patient have a blood glucose of 400, patient is for 30, we check urine, there's ketones, hold it, cancel surgery.
Yeah.
Any question? Who did not get it? You got it? Be careful. PO med will make you bleed. That's why they hold it, metformin, 48 hours before, 48 hours after. Let me tell you about insulin. Insulin is not more of the bleeding. Insulin is more of the potassium. Yes. If a diabetic patient is going on insulin, they will not be on IV insulin. They will not be on IV insulin. You only on insulin IV once you have diabetic ketoacidosis. They will be on regular insulin. And when we talk about sliding scale, anytime a diabetic patient going to have surgery, they will have sliding scale. And the sliding scale is always regular insulin.
Okay.
Sliding scale is a method so you don't call the doctor. If I give Kawala her insulin and her sugar is still high, this is where you go. That's what the sliding scale means. Yes?
So if the patient has ketones in
The urine.
you hold it or give it?
Oh, you hold it? No, you give it. You give the insulin, and the doctor will hold surgery, stop surgery, and put the patient in ICU. Once we fix the patient ketoacidosis, now we will resume surgery a month or 2 months later. Any question? Now, so Compartment syndrome is the first complication. And let me tell you where NCLEX get you. They put 2 hours post-cast. The day after post-cast. 2 days after post-cast. That is compartment syndrome. Anytime I say 3 days post-cast, it's no longer compartment syndrome. It is called fat embolism. Fat embolism is when the doctor is doing the cast. Glove, fat or grease, fat went into the blood and can cause you to die because of PE. That always happened 72 hours after. So listen, so NCLEX asks you, 2 hours after cast, post-cast, what would you see in the patient make you call the doctor? Do you know the student put dyspnea, which is shortness of breath? Why would that happen? That is fat embolism. When do fat embolism happen? Okay, so why did you put respiratory? It has to do with what? Circulation. If they put 3 days post-cast, now you put what? Shortness of breath.
What about tingling of the fingers? Like
That is what? Compartment syndrome. Okay. Who did not get that? Yes.
Back to the insulin, you said if you got a sliding scale, you don't need to call the doctor.
That's right. The sliding scale is called supplement insulin.
I know, but they give you a formula that says if it's greater than 400 and 200, call.
Let me explain something to you. They give you the patient their order, and they say if the patient is 250, give this. If the patient is 350, give. Then at the end it says if the patient is 400, 500, 600, give this. Call the doctor. When the patient 400, 500 like that, the reason they want you to call the doctor because I guarantee you the patient is in diabetic ketosis. Yes. So you have to call the doctor because we have to put the patient in ICU. Yes, you're going to call the doctor if it's not 400, 500, 600. But the point of the sliding scale, c'est pour parler des groupes à chaque 5 minutes. Yes, Robin.
For a patient that's like on traction, would you be at risk of pulmonary?
Yes, girl. Yes. Good question. The patient is on traction. Are you going to monitor the patient for DVT?
Yes.
Okay, so while the patient is on traction on one leg, what do you want to see on the other leg? Tense stocking or sequential device.
Yeah.
Anytime a patient on traction, what would they give them? Lovenox. SIOT, babe. That's pre-op, post-op. It's understood.
And then the monitor, they need PTI and
That's right. They're gonna monitor the PTT. Let me tell you, Lovenox. There's no PT-INR. PT-INR only for Coumadin. Lovenox, you will monitor PTT. Why? Because PTT means how long it takes you to clot. Yes.
So she said that my friend, she just got a job at the hospital, and when they call her for the interview, she's a new grad. And the nurse, the person that called her asked her about Lovenox, what value would you check?
That's right. And I hope she didn't say
She said
PT.
PTT.
That's right. I hope she didn't say PT-INR. They won't give her no damn job. PT-INR only go with Coumadin. Oh. Not only that, you see Kendrick, where nobody go look for job? Kendrick, when you go there, they give you a med search test. If you don't pass, you don't get no job because there's too many nurses out there. Kendrick give you an EKG test. EKG test, a med search test. I know JFK just hired 3 of my students. and they gave him a test. They were like, Miss Sonia, that test was so easy. Says, who gonna run? Wellington, they're giving tests now. Broward, they don't give no tests. Hell, if you don't know how to put a Foley, IV, you ain't getting no job. Right there when you thank you, go learn, come back. North Broward, I'm telling you, we all stood in line. Go put a Foley. Go put NG2. Soon as you fondle, goodbye. When you know, come back. That's why North Broward, you know who get jobs there? BCC nurses. BCC nurses are bad on the floor. Boy, they know how to put a Foley. BCC is big with skills. Nova, we big with our mind, our books. But BCC, you can't touch a BCC nurse when it comes to the floor. Oh my God, they so bad. Because BAD, bad mean good. Because BCC, you don't go on if you don't know how to put Foley IV by their side. Okay? Any question? Okay. Let's continue. So, fat embolism, you'll see restlessness, hypoxemia. That's why anytime a patient has fat embolism, you need to check O2 sat. Okay? Listen to the lung. I'm on page 860. C, anytime you have CAS, you can have what we call osteomyelitis, stinking bone. Yes. So they put you on Venco, you at risk for what? MRSA or what? Stevens-Johnson syndrome. Okay? Now, a vascular necrosis is blue. Right? Pain. Decreased sensation. Okay? And the last one, anytime you have a CAS, you at risk for DVT. DVT gives you PE. So that is why you give the Lovenox, you give the people 10 stockings on the good leg, people. You put 10 stockings on the good leg, Lovenox go here. How many inches? 2 inches, right? All right, and then 45 degrees, sub-Q, right? Lovenox, do you wipe after? No. Okay? Then the skill for multi-skeletal. Take your skill sheet out. The skills for multi-skeletal. Right? The skills for multi-skeletal. Ready? Take your skill sheet out. Look on your paper in the back of it. Okay, so let me show you how you're going to use this. You have a skill sheet. No way a student in here 2-3 months don't have a skill sheet. All right. Okay. In the back, who do not have a skill sheet, raise your hand. Nobody. It should be in your package. No, just, let me see your pack, the little thin one. There's a little thin one. Okay, who else does not have a skill sheet? Okay? Oh, I don't think Farrah gonna raise her hand. Okay, yes you can, go next door to Miss Christina and tell her I need 10 skill sheets. The skill, yes you do. Mommy, you got a skill sheet, true? Right here, it look like this. Like this. Yes you do, ma'am. Ma'am in the back, yes you do. You left it at home. You left it at home. Okay. All right. She gonna go get it. You never have. We gonna go get for you. Okay. All right. Shh. Look. In the back of your skill sheet, I want you, and guys, keep yourself, remember, unorganized student, you ain't gonna get no damn license, because if you're not organizing your book, your paper, you're not organizing your studying. So I already know, Papa said, because you're not organized. Organize your paper. Every piece of paper I give you is very important. Okay? Right? In the back of your skill paper, when I do the system, so look, okay, make stuff neat. So it should be, look, cardio, you're going to do respiratory, neat, right, and make space. Neuro skills, nice, right? Then we're going to do immune skills. Christina gonna get them. You gonna do endocrine, GI, neat, right? Right? All right. Multi-skeletal, right? Renal, cancer, skin. Okay, and then you can do OB skills. You can do bead skill. You'll notice some of them is double, but that help you. Nice and neat. You see, do it neat, and then we'll just fill in the box. Me mommy. Christina, she's gonna bring for me.
Yeah, because we don't have.
Okay, so she gonna go get for me. She's coming. Okay, so multi-skeletal skill. See? Multi-skeletal skill. You're going to put cane, walking. You got to do the skill. Crutch, walking. Right? How you go upstairs, downstairs with crutches. How you going to position patient after back surgery and amputation. Midley. So when would you do skills? S start with what day? So let's look at your studying pattern. Study, right? A. Monday and Tuesday will be your what? Med surge. So let's say it's multi-skeletal this week. Okay? You got a whole lot? Okay, raise your hand. Pass it. It shouldn't be a lot of people.